Today we're jumping into something called electrical muscle stimulation, or EMS. You've probably heard of it, especially if you deal with aches and pains, or you're just, curious about recovery tech.
That's right. And to make it real, think about someone like David. We came across his story. He's a truck driver
Hmm.
dealing with constant lower back pain. That sort of thing that just sticks with you.
Yeah, a lot of people can relate to that, unfortunately.
Exactly. So our mission today is really to explore how EMS might actually help people like David or really anyone looking for ways to live with less pain.
Okay, so let's break it down. EMS, what are we actually talking about here?
Well, basically it's using specific electrical currents to stimulate your muscles, makes them contract.
So it's kind of like forcing a muscle workout, but without you necessarily having to, lift weights or run.
In a way, yes, it causes muscle contractions. And that's why it could be really beneficial for people who maybe can't move easily, or perhaps they're recovering from an injury or even surgery.
Interesting. And I gather this is popping up more in places like chiropractic clinics now.
It really is. It's becoming a tool in modern chiropractic and rehab. It's not meant to replace the hands-on adjustments, the core chiropractic work.
It's more like an add-on, a booster.
Exactly, a complementary therapy,
Mm.
something non-invasive that can work alongside other treatments to hopefully speed up recovery and maybe give quicker relief, especially for that chronic pain that just feels relentless.
Right, like David's situation. So let's talk benefits. You mentioned pain relief. How does zapping a muscle actually stop it from hurting? Seems counterintuitive almost.
Well, it's about signals. Think of pain as a signal traveling along your nerves to your brain.
Yeah.
EMS, particularly certain types like TNNS, can send its own signals that essentially interfere with or block those pain messages.
Like running interference on the pain signal highway?
That's a good way to put it. It disrupts the signal before it gets interpreted as pain by the brain.
Yeah.
So for something debilitating like chronic lower back pain, that can be a big deal.
Okay, makes sense. Blocking the pain signal. But there's more to it, right? What about muscle strength? How does that work if you're not actively lifting anything?
Yeah, so your brain normally sends electrical signals, action potentials to tell your muscles to contract. EMS basically mimics those signals.
Ah, so it's speaking the muscle's language.
Precisely. The device sends controlled electrical pulses, usually through pads on your skin, that tell the muscle, contract now. Over time, with repeated contractions, the muscle can get stronger, just like with regular exercise. It helps prevent atrophy, muscle wasting, if someone's laid up.
Got it. So keeping muscles active even when the person isn't. And you also mentioned circulation.
Yes, well, whenever muscles contract, they squeeze the blood vessels within them. This helps push blood along and encourages fresh blood flow into the area.
So more activity, even electrically stimulated activity, means better blood flow.
Right, and better blood flow means more oxygen and nutrients get delivered to the tissues, which is obviously crucial for healing and repair.
Okay, like speeding up the delivery of healing supplies. And that ties into inflammation too, I suppose.
It does. Those muscle contractions also help stimulate the lymphatic system. Think of that as your body's drainage system.
Removing waste products and excess fluid.
Exactly. So by getting the muscles pumping, EMS helps improve that lymphatic drainage, which can reduce swelling or edema and inflammation around an injured area.
Okay, so let's recap. Pain blocking, muscle strengthening like a passive workout, boosting circulation, and helping drain inflammation. Quite a package.
It really covers several bases that are key for recovery.
Let's dig into the mechanism a bit more. How exactly does the electricity make the muscle move? It's not just a random jolt, right?
Definitely not random. It's all about controlled stimulation. The core idea is these electrical pulses mirror the natural signals from your brain and spinal cord.
The action potentials you mentioned earlier?
Correct. These pulses are delivered through electrodes, those sticky pads placed strategically on the skin over the muscle you want to target.
And the device controls the type of pulse.
Yes, and that's critical. A chiropractor or a therapist can adjust things like the frequency, how often the pulses come down, the pulse duration, how long each one lasts, and the intensity or strength of the pulse.
Why is that level of control so important?
Because different settings achieve different things. You might use one setting to primarily relieve pain, another to cause strong contractions for strengthening, maybe a different one to reduce spasms. It allows the treatment to be tailored very specifically to the patient's condition and goals.
Tailored treatment. That makes sense for getting the best results.
It helps target weakened muscles effectively or assist in, say, retraining a muscle after surgery.
Now, our source material mentions specific types of EMS devices you might find in a clinic. Can you walk us through those, like 10NS?
Sure. 10NS stands for transcutaneous electrical nerve stimulation. Its main job is pain relief. It sends stimulating pulses across the skin, transcutaneous means through the skin, to disrupt those pain signals we talked about.
So 10NS, pain disruption, got it. What's next?
Then you have NMES, neuromuscular electrical stimulation. This one is focused more on the muscle itself. It causes contractions to help with muscle recovery, rehabilitation, preventing atrophy, and building strength.
Okay, so NMES, muscle activation and strengthening, different goal.
Different primary goal, yes. Then there's IFC, or interferential current.
Interferential sounds complex.
The idea is it uses two different medium-frequency currents that interfere with each other deep in the tissue. This allows it to penetrate deeper than 10NS, potentially reaching deeper sources of pain or muscle spasm. It's also thought to improve localized blood flow.
So IFC is deeper penetration for pain and spasms.
That's a good summary. And finally, they mentioned Russian stimulators.
Russian stim. Sounds intense.
Chuckles slightly.
Yep.
It can be. It uses quite high frequencies, and is primarily aimed at significant muscle strengthening. You often see it used in sports medicine to help athletes really build back muscle mass and strength after major injuries.
Right, for more heavy-duty strengthening. So quite a range of tools depending on the need.
Definitely. Each has its place.
So, thinking back to David, our truck driver with the chronic back pain, how could using these devices, maybe under professional guidance, actually make a difference for him?
Well, you can see how combining these might work. Maybe 10NS or IFC initially to help manage the acute flare-ups of pain, just to get some immediate relief.
Okay, tackle the immediate pain first.
Right. But then, crucially, NMES could be used over time to strengthen the core muscles, the muscle supporting his spine, which might be weak and contributing to the chronic nature of the pain.
Addressing the underlying issue.
Exactly. It's that combination of symptom relief and actually working on the root causes the muscle weakness or imbalance, guided by a professional, that offers real potential. And importantly, it's a non-pharmacological approach.
Yeah, avoiding reliance on pain meds is a huge plus for many people. Now, let's hit some common questions people might have. What kinds of conditions, generally, is EMS used for?
Based on the info, it's commonly used for chronic pain conditions like back pain or arthritis, for muscle rehab after injuries or surgery, and also sometimes for improving general muscle strength and even endurance in athletes.
Seems versatile. What about safety? Is it safe for everyone?
Generally, it's considered safe when used correctly. But, and this is a big, it should really be done under medical or therapeutic supervision, especially if you have certain conditions like epilepsy, heart problems, or if you have implanted devices like a pacemaker or defibrillator. Definite no-go areas there without expert clearance.
Right. Always check with your doctor or therapist first. That's key. How quickly can someone expect results? Is it instant relief?
For pain relief, some people might notice a difference fairly quickly, maybe even during or right after the first few sessions. But for muscle strengthening and the longer-term rehab benefits, that takes time. You're looking at several weeks of consistent use usually. It's building tissue, essentially.
Patience and consistency are needed for the strengthening part. Makes sense. Now, can EMS just replace traditional physical therapy altogether?
That's a common question. Usually, no. It's best seen as a complement to physical therapy, not a replacement. It can help make PT exercises more effective or work muscles that are hard to activate consciously. But the active movement and functional training in PT are still really important. They work well together.
So part of a team approach?
Exactly. Don't just swap one for the other without discussing it with your healthcare provider.
Good advice. Lastly, any side effects to worry about?
The most common things are pretty mild, maybe some skin irritation under the electrode pads or some muscle soreness afterwards, kind of like you'd feel after a new workout.
Like delayed onset muscle soreness,
Yeah.
DOMS.
Yeah, potentially something similar. Making sure the pads are placed right and following the intensity guidelines helps minimize discomfort. If anything feels really off, you need to tell your therapist.
Okay. So wrapping this up, EMS seems like a genuinely promising avenue, doesn't it? Using electricity in a controlled way to manage pain, help muscles recover and get stronger, all without drugs or invasive procedures.
It really does. It taps into the body's own electrical system to promote healing and function. For people like David, stuck in that cycle of chronic pain, it offers, a tangible sense of hope for a more active, less limited life.
It definitely makes you think. Understanding our body's own electrical nature seems like such a powerful key.
It opens up a lot of possibilities.
Which leads to a final thought for you to mull over.
Yeah.
If we can harness electricity this way for muscles and nerves, what other ways might exploring the body's electrical system unlock new health approaches in the future? Beyond pain and muscle rehab, where else could this intersection of technology and our internal wiring take us? Something fascinating to consider. Thanks for joining us for this deep dive.